My eye allergies are so bad, and they are unfortunately getting worse and worse every single year. Today, I want to talk to you about how you can get relief from 4 of the most common eye allergy symptoms, and then we'll finish off the video with 4 of the most common mistakes that people make when it comes to their eye allergies. So be sure to stick around till the end of the video. Hi everyone, my name is Dr. Saya Nagori. I'm a board certified ophthalmologist, and you're watching the iFacts.com channel. Okay, symptom number 1 is itchy eyes. This is probably the most common and the most frustrating symptom, especially when it's really intense. You feel like you just want to really just mash the eyeball in, and that is definitely the last thing you want to do, because putting pressure on the cornea, especially on the front part of the eye, can actually change the shape of it if you do it over time, and can lead to things like keratoconus. So also, if your hands are not perfectly clean, you're gonna put debris on the eyes and eyelashes, which is just gonna make the itching worse. So you really want to just avoid intense rubbing. So the first thing you wanna do to get relief from the itchy eyes is you're gonna wash your face, and if you can take a shower and change your clothes, because this is gonna help wash away any allergens that are on the eyes and the skin near it. But before you get into the shower, if you have an oral antihistamine in the house that is usually available over the counter, like loratadine or sertrazine, you can take one of those if you haven't already taken one that day, and that can help you get some time for it to start working on the itchiness as you take a shower. Remember that anytime you start a medication, make sure it is not going to interact with your current medications, so check with your doctor before you start anything, even if it's over the counter. Now, if you're sitting there and you're like, yeah, I already take an oral allergy medication and it's still not working, well, this is when you want to talk to your doctor about maybe taking 2 different types. So for me personally, I will take one type of allergy pill in the morning that's over the counter, and then in the evening I'll take a different type if the allergy season is really bad. Now, if all this is still not helping you with your itchy eye symptoms, you can also try an over-the-counter eye drop that is specifically intended for itch relief. There are a few different eye drops out there over the counter, and they will specifically say anti-itch on them, and you may have to try a few different ones to figure out which ones work for you. Remember, if you wear contact lenses, you're gonna wanna remove the contact lenses before you put in any eye drops. Now, if you absolutely have to rub the eye because it is so itchy, just remember to rub the eye like this, and don't rub on the actual eyeball. Symptom number 2 is really watery eyes. So what do we do for really watery eyes that are associated with eye allergies? What you're gonna wanna do is do the oral medication like before, but if you're already doing this, then you also wanna incorporate using some artificial tears. Now, in an ideal situation, the artificial tears should be preservative free. And watery eyes can be a sign of eye allergies, but they can also be a sign of dry eye, and dry eye and allergies can happen together. So when the eye is dry, it's a little unusual, but it sends a signal to the brain saying, hey, I'm dry. And then the brain sends a signal to the gland, telling the gland, the eye is dry, can you please make more tears? So then the eye starts watering. You may be wondering, well, if the eye is watering, why is it dry? Well, the tears that are made in this specific process are not high quality. So they just make your eyes look runny and watery, but they're not actually providing hydration. So you're gonna wanna use artificial tears, especially preservative-free, if watery eyes is one of the symptoms that you're experiencing. Now, symptoms 3 and 4 come hand in hand, and that is headache and light sensitivity. Eye allergies are often associated with having a headache and also some light sensitivity. It doesn't happen to everyone, but it can happen sometimes. Now, the headache can happen just because of the allergy itself. So I know when my husband has his dust mite allergy, his most prominent symptom is actually a headache and not really any eye symptoms. But also for patients who are already having an eye allergy, they may be straining visually, and then this can cause a headache as well. When you combine that with having dry eye, watery eyes, and also itchy eyes, You may also get some light sensitivity. So for these symptoms, you're gonna wanna take a shower, stay indoors, and maybe even sit in a room that doesn't have bright lights. This will not only help you avoid the allergens that are outside, but it'll also give you a break from any sunlight that could be aggravating your headache and your light sensitivity. Now remember, if your headache does not go away with normal over-the-counter painkillers, or if it's incredibly severe, definitely check in with your doctor to make sure it's not something more serious that you really need to go in for. Artificial tears can also help with light sensitivity, especially when it's associated with eye allergies. So now, what are the 4 biggest mistakes that people make when it comes to treating their eye allergies? Mistake number 1 of 4 is not knowing what you're allergic to. When it comes to allergies, the best way to not have them is actually allergen avoidance, but you don't know what to avoid if you don't know what you're allergic to. So, getting allergy tested can be really helpful if your allergies are making you miserable. So maybe you're more allergic to tree pollen or more allergic to ragweed, and you can actually Google when these allergens are sort of high in the environment, and then maybe choose to be outside or not be outside based on when those allergens are really prevalent. Mistake number 2 is not using over-the-counter medication consistently. I know it's hard to remember to take allergy medications, especially if you're not having any symptoms, but actually being consistent with the medication, especially during allergy season, can really help to keep allergies under control. Mistake number 3 is not considering more advanced solutions. So this is the first year that I am, for myself, personally considering getting allergy shots because I have been so miserable this year, and actually last year was when the misery really escalated in terms of how bad my allergies were. But I just couldn't bring myself around to going every week for the shots, and also it's a little bit intimidating. There are also sublingual or under the tongue medications that can be used for certain allergens, but they don't apply for every single allergen. Now, unfortunately, due to global warming, the allergy seasons are actually just getting longer and longer. So before, I only needed medication from maybe mid to late April to just about September. And now I find myself using my over-the-counter allergy medications sometimes in late February and almost through October. So allergy shots unfortunately don't work right away, and you do have to be consistent about going in for the shots. But if you're really miserable, something to consider is seeing an allergist and asking about this. The 4th mistake is thinking that allergies is pink eye or thinking pink eye is allergies. Remember that allergies can actually look really similar to pink eye because they can both cause itchy red eyes. So check out this video right here to better understand the difference. What questions do you have about eye allergies? Be sure to drop them in the comments below and I'll do my best to answer them. Thanks for watching. Please support the channel by hitting subscribe, and I'll see you in the next video.